who you are. And let's see, I just saw someone is new. Marie, would you like to introduce yourself?
Yeah, hi all. Nice to see everybody today. My name is Marie Hoge. I'm at Memorial Sloan Kettering Cancer Center in New York City. I'm a longtime internal OD practitioner, doing a lot of work right now with small groups and team and group coaching. So I'm excited to hear some of the material that we're going to be talking about today and see a few familiar faces as well.
Great, Marie, great to have you. And Megan, you're new.
Thank you. Yes, I'm from Johns Hopkins in Baltimore, and I lead the development of e-learnings as well as the management of the learning management system.
Cool. Nice to have you, Megan. Mary, you want to say hello? Oh, Cindy, you were raising your hand.
Oh, that's okay. Hi, Cindy Zito. So I am from Henry Ford Health Systems. So we're not new to the system, but I'm new here to the meetings. I think it's been many, many years when I've sat in on that and trying to get back in to some of these meetings. Very valuable here. But I'm an OE consultant, organizational effectiveness consultant for Henry Ford. So
good to have you. Thank you, Cindy.
Yeah, thank you.
Nice to see you.
And I'll go
Anyone
ahead.
else new? Yeah, Mary, go ahead.
Yeah, hi. Thanks so much for the opportunity to join as a file member. Mary Nash, Vice President for Talent Development for Beth Israel Lahey Health. And we're a 15, soon to be 16 hospital system, about 36,000 employees, headquartered in Cambridge. And I've participated in NCHL both when I was with Rush and also with NYU Langone. So really excited to be potentially bringing our new system into the NCHL fold. So thank you.
Have you, Mary. And someone just put in the chat, I think Clarissa, it was you. This is a great question because we actually get this quite often. All of the calls, all of the Lens Council calls are recorded, and we put the recordings in shortly after each meeting along with the meeting notes in our member portal. So if you maybe don't know how to access the member portal, please send myself or Megan, Usain, a note, and we can send you some instructions for accessing the portal. But you can find recordings and notes from all past calls in that member portal. So great question. Thank you, Clarissa. All right, Anne, are you able to share the agenda? And then I know we'll introduce DJ here in a minute, but if you can share the screen.
Sure.
So just a few NCHL business items or updates to share. I mentioned our trial membership. And I did want to mention that we do have a new senior manager joining the Lens team. She actually starts next week, so we're not introducing her today, but since this group meets every other month, I just wanted to give you a heads up. Her name's Ren Lovegood. And she'll be joining as our senior manager, and you'll meet her in August, September on our next call. You'll see an announcement go out, but I did want to just give a heads up. Megan and I are still obviously involved in Lens, and you'll see us on the calls as well, but I just wanted to mention that. And hopefully everyone on this call has seen announcements about our all member conference. And just a reminder that the conference will be held November 14th through the 16th in Chicago at the Western River North Hotel. And registration is open. As a Lens member, depending on what level membership your organization has, you receive complimentary tickets or ticket to the conference and using a promo code. So hopefully we will see many of you at this year's conference. All of the information about the agenda, it's coming together great. We have our keynote speakers lined up. We have our roundtable discussions. We have most if not all of our breakout session discussions finalized. So you can check out all of that information on our website at nchl.org. And again, feel free to register early or book your hotel room early if you plan to come to Chicago in November. And the last announcement I have is just a reminder for our coffee chat. Hopefully you all have been able to participate in some of our bi-monthly coffee chats. This month will be focused on retention and growth strategies for the workforce in the future. And we have a few of our corporate members that are going to be panelists speaking on that coffee chat this month. There's no charge to participate, but you do need to register in order to get the link. You'll be able to register on our website as well if you haven't seen the announcements come through. And Megan Hussein, I'm going to say your last name because we have a Megan Hummel, and that's, you're both spelled the same. So, but Megan, NCHL Megan, you had a couple other announcements.
Thank you. I will have to say the spelling of her name is the best way, but you know, we may be biased. So there are two other additional announcements. Most of you hopefully received the Lens Connection newsletter last night or this morning when you logged in. But if you haven't, or I just wanted to call your attention to, there was a new element within the Lens Connection newsletter that will hopefully be integrated into these council agendas moving forward as well. But there is an opportunity for you to give asynchronous kind of topic discussion and council suggestions for presentations. So if you're looking to hear something during council calls that you haven't yet heard, or you have a priority that you want to call our attention to internally at NCHL to then share with the council chairs, you have that opportunity now to provide that input through the Lens Connection. There's a link on that newsletter, but you will also start to see that link to those surveys on your agendas most likely as well. So wanted to call attention to that. And also we just released our 2022 annual member satisfaction and engagement survey that was sent as a separate email, and we're looking for more than one input from each organization. So as many of you that can complete it from your organization, the better, but we really are looking for feedback and comments around just your general level of satisfaction and the value you find within NCHL and the Lens program. So please respond to that if you get an opportunity. That's all, Leanne. Thank you.
All right, I was gonna hope you could stretch your presentation out a little bit more because DJ just had to go answer the front door. So we just lost our main speaker. So let me see just quickly if there's anything else in the chat. No. Okay. So let me just talk a little bit about the focus for today's discussion and conversation. And for those of you who are new, what Megan was just talking about in terms of how we're always looking for discussion items and the such. These calls, all of our council calls, are meant to be very safe and engaging for everybody to share. So we follow what we call the Vegas rules in terms of whatever shared here stays here within this, you know, this community of members and leaders on this call. So, you know, we want to ensure a safe environment for open dialogue and sharing. So I just wanted to kind of put that into context for those of you who haven't participated on some of our council calls and kind of wondering like, oh my goodness, like I'm gonna, you know, be sharing intimate details about our organization or your professional you know, strategies and such. So this is a safe environment for everybody to share. So with that, DJ, you're back. Everything good? Is she back?
Yeah, everything's fine. Yeah, I had a repairman here from GE. I needed to let him know.
No worries. I understand how that goes. So any questions? Well, how many of you know DJ? Maybe just raise of hands. DJ has been a long time partner of NCHL. She and her team and organization provided our Coach Academy last year. And many of you, I think, are participating in the program again this year. We didn't have enough people to host our own NCHL program, but DJ was kind enough to extend our NCHL pricing and opportunity to many of our members and has the opportunity to participate. I think the program starts in August. Is that right, DJ?
Yes, it starts August.
Yeah. So just DJ is a renowned expert, executive coach, and we're pleased to have her with us today. We're going to really just open the floor and listen from DJ and her expertise on the current trends around coaching, the current changes that are happening, and specifically maybe about physician coaching, have a dialogue around physician coaching, what's unique to that particular group, and then just have an open dialogue of what's coming up in regards to coaching within your organization, and how is your organization continuing to develop certified coaches within to help your employees and your workforce. So DJ, I'm gonna turn it over to you. I think you can share your screen.
Yeah, I will
share
share
your resources. Yeah.
Yes. And I hear you speak about the agenda, and I realize how big it is, right? To try to cover for you all the things that we'd really love to cover in a 45-minute dialogue. And I really want this to be a dialogue. When I first had Leanne ask me to present to you today, really to just, hang out with you today, to look at these things, I thought, where am I going to start? So I sent the questions out to a group of people who have been through our programs and graduated, who are actually in this environment, and some of the members of LENS. So I'm going to share with you some of the trends to start a part of the conversation. I sent out through Leanne the Surgeon General's report, which I think is stunning. And then I'm just going to kind of give you some background. So I'm going to talk for a few minutes, and then I'd really like for this to be a more robust conversation and dialogue. So let me just show you what I prepared for you today. And I did this kind of on the fly because Leanne said, just come and be with us. And I was like, I don't just come and be with you. I have to put my head around what I want to say. So the pandemic before COVID, this is from Dr. Cindy Ackrell, who does some of our work. And, as a neuroscientist and researcher, some of the work that we see happening is really giving us a picture like a before and after COVID. And so the medical visits before COVID, as you all know, were stress related, and most health problems are still stress related. But in the past 2 years, because of the pandemic, the chronic stress and the things that we're seeing have really shaped new identities for providers, and they have put pressures on the systems that you all know about that are just unbelievable. And with everything else that we're seeing, Gallup just put out a poll result last week that said beyond these chronic stress factors and depression as a leading cause of illness and the greater risk factor for heart disease, et cetera, we also are seeing sadness, and I'm going to say sadness and grief, because that's a trend that I'm seeing, is that there's a loss of identity, but there's also not knowing how to park or even articulate the sadness in the environment that we're in for coaching. And it's true across all industry, but a lot of fingers are pointing at the healthcare industry. It's like, and I hear a lot about it still being a broken system, right? And so I also see, because we work inside these systems, a lot that's going really right? And so I know there are several of you from Henry Ford Health Systems, and Mara and your team, you all are doing, amazing work to lift culture around coaching there. I know there are so many others that are Vanderbilt, and, we can name them. You all represent them. But this I thought was stunning. If you haven't seen this Gallup report from last week, you might want to pull it down and just take a look. But 28% of people said they experienced a lot of sadness the previous day. That's a higher percentage than it's ever been. It's almost 30%. It's never been anywhere close to that. And then 42% of people said they experienced a lot of worry from the previous day, up 40% from 2020. And I have in my life, I have a young woman who my son is going to marry, who is a nurse working on her nurse practitioner degree. And I was with them couple months ago when she came home after a gang fight and a young man had had his face blown off in a emergency room she was attending that day. And she said, you know, I've worked in ICU units, I've worked in the emergency room, but what's happening more and more is because I couldn't let the family back, now my life is in danger. I have been threatened. And I know that you all see this in your systems because I know that when I go in to take care of people I love, that there are signs up that say something about, you know, how you respect the workers, particularly the nursing staff. And so you layer that, the gun violence, all the things that people are seeing in the news on top of what we're dealing with. And what I notice is providers are carrying unspoken grief. And so how do we tap into that as coaches, right? How do we, most coaches that we've trained are just beginning to play with how, and I say play intentionally, play with how do you coach someone around that notion? You know, how do you really have them articulated? Because it's so insidious. And so that's one of the things I think would be interesting for us to discuss today. And I'd like to just cover a few more trends and then come back to this, is what do we do with the grief and with the threats? So some relevant trends that I've seen in coaching, and these were underscored by the people that I surveyed, is there's more proactive and selective approaches about who to coach. Not every leader gets a coach, but it's, you know, often the leaders need to have performance conversations and they don't know how. And so there's been a lot of, let's just give them a coach as one way to solve the problem. And so there's discernment, and I see a high level of discernment there. So optimizing access to other interventions when they're important or needed. And if you, I'm sure you all have your EAPs online, but having your coaches, particularly your external coach partners, know what to say about the EAP, when to refer. So if we start down a path, and I've done this recently in a system, where a senior leader hired from another system and I were coaching, and he had something that needed to be addressed by another professional. And so how do you know, one of the things we do when we contract in is we make sure we know what to say. But, you know, I don't know that every coach is prepared to do that. And so how do you prepare us? Realizing identity is often at stake. So this is ego versus psyche. And one of the things that we distinguish in our coach training is that we use the Enneagram as a context setter for, you know, who we are as a series of patterns and how we've developed ego personality over time and identity. And then we look at the inflection point between who we really are, core essence, psyche, the spirit, the part of us that is animated by our work and that is coming to life, hopefully every day. And so, you know, as coaches, one of the things that we focus on is that inflection point between that ego, identity, personality, and who people really are. One of the reasons coaching was born as an industry is so we could get into meaning again. We are evolving consciousness. And Meg Wheatley said at our conference in 2001 in Chicago, as a keynote speaker, she said, we're not making this up. Coaching has been called out of us. This is our turn to serve the universe. And so however you hear that, what I want you to hear underneath that is I coach around the world. And one of the things I've seen as a trend is that we have the opportunity to be engaging in conversations that are consistently consciousness raising, and we can do what politics and religion have failed to do. And so for me, this is a mission, right? It is important work. And coaching comes from sports. So it's like, how do we bring lightness into a space where there's sadness, grief, and the levels of stress that we're seeing? So there's a real opportunity, I think we all have, for innovation around our role. So I just want to kind of plant that as part of our discussion today too. And then the other thing that we see, and this is being asked for over and over again, is more training for leaders to coach. So a leaders coach program, more leadership development so they interface effectively with administrators and colleagues. One of the things that I also saw that was pretty stunning in the past 2 years is physicians whose family all had COVID. They're clients of mine. They put their head on the desk for the first 5 minutes because they're so exhausted. And then they look up and say, and I've got to go into a budget meeting next. And so I've got to work with administrators and my heart's not in it today. And so How do we give them tools to be present to what's in front of them and to not forget all of the mandates and obligations, but to ask for what they need to be able to set boundaries, to not be hero archetypes. So that's one of the things that I see. More coaching also for senior leaders where there's something that doesn't work anymore. What was tried and true about the way we do things is no longer tried and true. We don't know where to go for answers. And this is prevalent. So it's like, how do you coach for innovation? And that's one of the other pieces that I think coaches you've got to be trained in is, what does innovation mean in your culture? How do you define culture? And for me, culture is a story we tell. It doesn't matter what you put on the wall and what you say it is. It matters what people say about it, right? It's those who are living in it every day and what they want or need in private conversations. How does that surface or bubble up? And so, where are you disconnected and where are you really in a place of expanding or innovating? And I think there's opportunity there. This is the resounding trend that came from my little survey this week. And that is, we are putting a lot more people in peer level groups, and it's efficient. There's more impact. And this goes from some of you who have the dyad conversations going on with your physician and peer work to every level, nurses, CNAs, administrators, it's at every level, and to generate dialogues. And so who are the best group coaches? What do you need to refine in your group coaching approach? And so I'm sending an article. I've asked Leanne to drop an article that I wrote with Ginger Cockerham, who passed away a few years ago. But Ginger was a woman who was really pro on group coaching. She was featured. She worked in London. She's all over the place. And she wrote a book called Group Coaching. It's still a great guide. If you don't have that book in your library, it's still available on Amazon. Get it. And it has a pattern for group coaching. And then if you'd like to come to a group coaching class, we can talk about maybe Leanne just doing one-off around that, just to focus on how do you initiate a group. If you don't know how already, or how do your coaches initiate groups, what are the themes that you want to be pulling through, given some of the things you see? How do you really have the group help set the agenda? Where do you, basically it's a good, where do you start, right? So that's one thing hopefully you're seeing, and I'd love to see a show of hands when I get through the rest of this. We'll just go back and look at that one. The other one is reducing barriers for access to wellness coaching. So there's a lot more attention. We've had several wellness Ayurveda coaches go through our program who are already established, and they wanted to get more into corporate work. And so I see a blend of wellness coaching and corporate leadership coaching. And I think that's going to be important for physician leaders. And the other thing is prompting a culture of personal obligation to self-care and boundaries, and having the physician leaders that you work with really understand what that means, and then to honor it, respect it, and teach it, train it for other people. The other thing that we've seen is senior providers and chairs need to shift from sacrifice and I will work whatever hours I have to work, and a lack of self-care model to modeling the balance. It's like everybody looks up and they go, if that's what it looks like, right? Your residents, when they're matching if that's what it looks like, then I've got to do it that way. And so how do you really shift that? And then the other thing that one of my respondents said, who is a physician provider chair, said, coaching requires a bit of confidence and courage to cut through. And he didn't say it this way, but I'll just clean it up. Impression management. It's, how do you, particularly for those of you who are inside and who are coaching, or who have an internal coach cadre, as you report to some of these folks, or they have ownership of your career at some level, how do you find the courage to say what really needs to be said about identity, ego, psyche, what you're seeing they need, and when they need to go someplace else in the organization? So that's one of the things that we see in our training, in our long version training, is that there's a need for that. Realize when to bring in professional coaches from an outside organization, how you vet those, when talent leaders coach those where there's an agenda. The other one is teaming, and I love that somebody said you're working with the team coaching idea. So the ICF, for those of you who are members, and those of you who are not, you might want to look at that, has new team coaching competencies. And we have a program that we teach that I was the original team coach at AOL.com. That's how people knew me on my name tag in 1995 and 96 when we were first getting this coaching thing going. And so teamwork has been my sweet spot for many, many years. And we have a program we teach across the country, and I'm sorry, across the world. But what I want you to know is that's new for most systems in this environment. And while there's an action learning, while there are a lot of other learning models, pure team coaching, where you really give a framework of agreements and you're looking at what are we playing for, when you're looking at the management by objectives, whatever the strat plans are, whatever it is that you're coaching to, how do you bring people together so they're teaming in a way that they take ownership of it? How do you get the team leader or the matrix team to take different roles? So there are a lot of complexities in team coaching, and it's something that I see is a hard uptake in most organizations because of the time that it takes. So that's a big conversation. It's coming, and it still feels new based on all the systems that we have plugged into. And then the Great Resignation, that was a question that Leanne sent out to me when we first started looking at this. And so as I probed a little bit more to get your language, their language, some who represent you all, for physicians, it's also right now a great reprioritization. And we have seen this. In our last cohort, we had 2 CEOs, we had 9 physician leaders who were amazing, and we have 5 talent leaders. And so that mix gave everybody a real interesting insight, right? A pathway of looking at what do we really need. And for physicians, the great reduction in time. So we have had several physicians that wanted reduction in time. Nobody listened to them. So instead of going, reducing 20% of their time, they left. 2 of those 5 people that I'm thinking of became coaches, full-time coaches. And they're going back into organizations, and some into their same organizations where they are now being paid an equal amount of money for coaching when they could still be providing services. And what you have seen in the not Great Resignation, but in the Surgeon General's report is that's a problem. That's a problem for your administrators and executives to address. And how are you going to level set so that people are really heard and their wishes, desires are honored? And for nurses and other providers mid-level, they may not leave the practice of medicine, but they can be hired away easily. So we've also seen a trend, right, for that, and for more contract work. And they easily leave for better perceived cultures, more pay, and less hours. So all of that to say, what does this mean for coaches who are committed to both the organizational mandate and the individual client? I'm going to hit this before I leave the slides, but I'll do that in a few minutes. I'd really like to generate a conversation based on what I've covered so far and see what else you're seeing and what else you think needs to be brought forward and the questions you have. So jump in, and you can do that best by just raising your hand, and then I'll find you. What are your questions, ideas, insights based on what I've covered so far? That's a lot, right? That's a lot. What else are you seeing?
TJ, I will say that I guess unfortunately the stats and the data that you share mimics all too closely probably what each one of us is seeing, feeling, and trying to solve for.
Yeah.
I wish the data was different, meaning that maybe we were entering a different part of the trend, but it seems like that is not the case. And I guess as somebody who works in healthcare, coaches and is working in a field trying to help leaders do the same thing for their team members, it seems like it is an uphill climb with a battle, a very strong battle ahead.
Yeah, so as I'm listening to you all, I think maybe taking a group coaching approach could be a really interesting thing for us to do. So when we have a picture or a frame, one of the things we do as coaches is to reframe, right? Reframe, where would you ultimately like to see this? And then let's take a look at the gap between those 2 things. So if this is our reality, the trends that I've shared with you, and it sounds like it is, it mirrors what you're dealing with every day, what would be an ultimate place for you to land in the next 6 months? Let's just play with that. Like as if there were no rules and no, oh my God, we can't. But let's just put it out there. What would you like to see? And Patty, why don't you start? What would you really like to see?
I mean, I would like to see some of those trending numbers come down, to see that I think that was 40 or 43% of individuals who were surveyed said that they, were, I forgot the exact wording, were stressed, carried over from yesterday.
Worried, they're worried.
Yeah, so worried and stressed. I mean, I guess if they were either found a better way of coping,
yeah,
or that the environment was doing what it could to reduce that number. I mean, I don't know if we'll get it down to 10%, but to me, that seems much more realistic or palatable.
Yeah.
But I'd like to see it at 0. Don't get me wrong, but I'm just saying I can't imagine that we would get down to 0 in the next 6 months. So I was trying to be realistic.
Yeah, so so what I'd like to do is reduce that number, is what I'm hearing, and whatever we could do to address that. And you might want to find out, what does it look like in your organization, right? So where are your touch points, viewpoints, how are you assessing this for yourselves? And you can read the Gallup report, and it gives you a model basically for questions to ask, right? So what are the questions we need to ask, if only 1 or 2? One thing I also recommend you do is to have representatives of each of the work groups that you support become knighted as change agents. And this is something that's a pretty easy thing to do, to train them just to go listen and to run listening sessions throughout the organization right now, just to get a list of all the themes and the things that you hear are, really on the minds of the folks. And then to give those to senior leaders with a goal and a theme report of, here are the ones that are most prevalent, and look at, what do we do with this gap? How do we address this? What can you make a change around today? So this brings the notion of innovation to your senior leaders in a way that they can say, okay, if this is what people are saying, and this is a storyline, we want to create a new story. What can we address? Maybe it's one thing, right? Maybe it's a way that you're compensating, but right now you need the front line to have a voice and to feel heard, so that there's a building of trust again, because that has eroded. So that's one thing that I would look at. And this is going to sound like I'm promoting just my work, and I don't mean to, but we did a body of research around this, and we moved engagement from 59 to 60% to over 90% in one organization that merged 5 companies by knighting change agents. So in the book Zombies to Zealots, if you go to that back chapter and that's all you read, it gives you a pattern for how to do that, the questions to ask, how to run one. So that's one thing you might do to address this gap, and to look at, if what we want to change, like with these change agents that we worked with in Sanofi, our first 90 days was to change the water cooler coaching conversation from I can't to we can. So find the one storyline you want to change. And it might be something like that, it might be something else, but what's the storyline? And then get busy. Have people listen, have people feel like they're being heard, they get to say whatever they want to say, and then have your senior leadership address 1 or 2 things right away, because it looks like there's movement for these folks. It helps build trust. So that's a piece. So in our spirit of group coaching, we've started with Patty. You've been given some ideas. Tell me who else has an idea or something you'd like to stretch into that you would be able to run or exact a change around in your organization.
I think at least in our organization, let's see, maybe let me switch to my computers.
Yeah, because right now you're just Zoom user. I don't know who you are.
I know, I've got it on my phone and the computer.
Okay.
So
Who are you?
Okay. Hi.
Hi. Great. Okay, good.
It's Marguerite. I'm with Intermountain Healthcare in Utah. And I think the new sort of chapter I feel like I'm in is cost containment and value. And how do we use group coaching to affect more leaders for less cost? So I'm really like exploring, we're in the middle of our coach programs and system 3.0 design. So we've been using a system of coaching since 2014, and this will be our third major design change. And we're doing that right now. And group coaching will be a big part of it. Not only for the cost reasons, although that's a big driver, but the issues that people are experiencing, especially physician leaders, as you're describing, have to do with a lack of social support, a feeling of isolation, of loneliness, and those are not well addressed or as well addressed in a coaching conversation where action items are designed to go and do later by yourself. And the other thing that's really becoming more prevalent, you know, with the speed of change, learning from peers in a group like that accelerates on many levels, not just the psychosocial support or adjustment of the leaders, which is a big deal now. I mean, we're having to deal a lot with that.
Yeah, so how are you preparing your folks for change leadership? And what is the role of coaching you see there in Intermountain?
Yeah, I like your systematic approach to it. There's, we're probably not alone in this, but I'll just, you know, air our dirty laundry. There's a little bit of chatter in the organization since I've been there for the last 8 years about who owns change leadership. So anybody that does anything that labels it or acts like they own it usually creates some ripple effect in the organization. So I try to do that a little bit more underground. But our OD department does a lot with change management. We do a lot of multidisciplinary interventions where we're bringing together engagement, OD, leadership development together. All of those deployed very systematically through a vertical of leaders that are scoring like as a tier 3 team, which is a team that's low on leadership index, low on engagement.
So one of the things to do is to look at how you're categorizing your groups and then to, you know, really determine where is the inflection point where if we exact change, if we run our listening sessions, if we start with a group, who would give us the most lift, right? Where is that in the organization?
It's physician leaders. We already know that.
Okay, good.
Because their engagement is actually trending down.
Right. And that's what we're seeing. And one of the respondents said 58 to 65-year-olds are just leaving. They're just retiring in our organization. And then the roles are going to somebody who's very junior and they're not ready. And so, you know, so as you're looking at these pieces, it's then to go back and cast a vision for what can we exact in the next 6 months, right? So if I'm putting you in a group coaching experience, it's like, what can you all imagine doing? And if it's around change, what is the coaching framework you're going to use to be in that conversation with people? And if it's group coaching for them or if it's team coaching, and I would recommend team coaching, where they're actually focused on a group outcome, a team outcome that will give you lift in a really big way soon, right? So what I see is, and you said something, Marguerite, that I want to underscore is the speed of change. And I know you all are going to just shake your head. Yes, the speed of change is breathtaking. And none of us are prepared for it, even the coaching community, right?
I just read that the knowledge in the world is doubling every 12 hours.
Mm-hmm.
You know, that's like Richter scale.
Yeah. Yeah. So how?
It's no wonder. I mean, just look at how much time just in the last 3 months you spend, all of you guys on the call, my friends, how much time we're spending just moving information around, trying to read something that's come in, put it someplace, access it again, use it, implement it. I'm spending like a scary amount of time just moving information around, trying to organize it, keep it, use it. And it's just coming at me like an avalanche. And I've finally just the last couple of weeks realized, wait, I need a whole new plot with this.
Yeah. So So if you all were coaching each other, what would you see here? When you've got that kind of onslaught of information and you know that your physician leaders are in the same space, we're all in the same space. When I saw that I was spending 7 hours a day on this, and I'm not playing Wordle, I'm just answering, it's like, oh dear Lord, it's like how, when we are so connected with our devices, what does that give us as an opportunity? So instead of looking at the complaint that we have about it, is to say, if we are in this frame and we're looking at a reframe, where do we want to go? What do we have control over? How do we, one of the things that we've done in one organization is to codify email so that there are, if it's important and you need to respond, it gets a 1 in the subject line. If it's something that you just need to know about and respond to later, 2. If you just need to look at this one day, 3. So, and that came out of the organization. So how do you simplify the flow of information, or do you want to?
Well, I love your suggestion. It's given me an immediate idea of something I'm going to go and do differently. One of our regions have particularly low engagement scores with physicians, like a big dip. And so the whole, region leadership team is, activated. And so it'd be very easy for me to step in with this solution.
Yeah.
And I think it could be a great demonstration project. And we have a captive group that we can model with data, the impact of coaching.
Good, absolutely. And once you get a story going about coaching, then that becomes a part of the culture, right? So to have a culture.
Yeah, we have that. I mean, I'm not concerned about that, but I think it's nice for a reboot since we just had a huge merger.
Good. Yeah, great. All right, so let's hear from some of you others. I know you're sitting there, we're generating ideas.
Mine isn't an idea, but I hope you'll indulge me. It's just kind of a comment. I came back from maternity leave 3 months ago, and I've been seeing a really strong pattern of I'm getting high-level physicians, surgeons, trauma surgeons, and so on, who are basically now not in trouble yet, but their level of stress has maxed out to the point where now they're snapping at people, they're writing mean emails and things like that. And I so badly want to help them because they are coming from a good place, but the pressure on them is just immense. And it's not really pointing at one specific thing. It's coming from all angles. And I feel like it does kind of tie into the trends you mentioned, but I was just curious if you had any other comments or thoughts.
Yeah, I mean, here's another opportunity for you all who coach inside organizations. That is to, the master skill in coaching. Master coaches are light in our approach. And so how do you lighten up when you're inside the heaviness of the story, right? When you're in the energy of the story, how do you look at folks that you're supporting and have them lighten up, right? And I'm just going to tell you a personal approach. You don't have to adopt this. It's my personality and it works for me. It probably doesn't work for a lot of people. But and I have had one of those people who was the chair of a department and reported to a chancellor. And I said, you're snapping at people. It sounds like you're snapping at people. He said, well, I am. I said, and what do you want to do with that? You want to be known as a snapper? I said, no, I don't want to be known as a snapper. So later that day, I get a snapping turtle picture on my phone. He said, this is going to live in my head every time I have a conversation. So sometimes it's calling out what you see, but doing it in a way that is not judgmental or threatening. I also had somebody who is probably in the last 10 years of his career that I have been coaching, and he was just heartbroken. And I will say heartbroken is something I'm seeing a lot. Heartbreak is something I'm seeing a lot. Is they're looking up and going, this isn't what I signed up for. In the columns of consciousness that we play in, right? In coaching, there's the tribal, the individuation, symbolic. Physician leaders go to symbolic from the time they set out to become a physician, because they are about purpose and meaning. And so when they look up and the purpose and meaning is so watered down, and all of the mandates and context construct. Part of what we do, I think, is to get them back to why they do what they do, and to have them look at what they have control over inside of all of the, you know, the surround sound. So, you know, that's for me, at least one of the places I look initially, is to have them reclaim their identity, but have them do it from soul purpose. And, you know, we look at their patterns of behavior, and I use the Enneagram. You know, we've all got access to a bunch of assessments, and a lot of those assessments, and I'm going to say this very deliberately, when they are covered for people, they go in a drawer, never to be accessed again. But what happens with these physician leaders is they feel like that information lives, and it's a story about them. So if it's just one or two dings, you're working with achiever level people who are all about that. And now they've had a chink in their armor and their superhero cape is off, but nobody helps them get beyond that and really move. So and this is not a judgment about you all, it is what I am seeing as a pattern. That there's a lack of resources about what do we do now with this information. So the better information is not to pigeonhole people in 4-box assessments. I'm finding as for physician leaders, you know, where it's you're a this or a this, you're either or. What we're looking for today around change is both and. Who are you really? How are you showing up? What are your patterns of behavior, and how are they serving people or not? And if you can get clean about that in your self-awareness, Mr., Ms. Leader, Doctor, then you will be more powerful and more empowering. So those are some simple things. I know that we're going to have to kind of look at wrapping up. And if I were really coaching the group, I would have hit all of you. We don't have time for that today, but maybe one more person has a comment about what you've just heard, or something you're going to take forward, or something you really have a question about. I have time for one more of those, and then I'll wrap up with some changes that you need to know about that are coming from ICF if you haven't paid attention to that lately. So anybody else have input, ideas, something that you'd like to share?
Yeah. We just did quite a bit of work with peer group coaching in a high potential program with about 85 people, and are now trying to pivot to offer some peer group work outside of a programmatic context. But the thing that sparked for me when you were talking initially is what I would like to see in the organization is more colleagues looking to colleagues for support and solutions with all of the grief that you're naming. That I feel like our culture is so MSK, I mean, my organization's culture and our culture more broadly is so focused on the individual, and there's so much power when they are connecting with each other, but
Right.
there's all of this barrier and sense that it's not okay or safe or normal for them to do that, and there's Zoom and all of these other barriers. So my 6-month aspiration is I've helped more people connect with each other to solve their problems, or even just not even to solve, but just to be with each other as they live in this grief or manage and lead through the grief in the times that they're in.
I love that, Marie. Thank you. It's a good place for us to sort of pivot for the closure. You know, we start in training coaches in that there are 2 domains of being, and they are shaped by our narrative every day. There's fear and there's love, or care. We use care in some organizations because, but so you've got those 2 things. And if you begin to listen, and your job is frame and reframe, if you begin to listen to where is the grief, where is the heartbreak, where is the sadness, just having people name that, particularly in peer level conversations, and to look at, okay, you've named it, you felt it, you know, and coaching is a path of integration. What do you want to bring up into your executive brain? What do you need to really handle so that you can move back into your creative space? Because as long as we're in fear, we're in that reptilian space. We're in that fight or flight survival mode. Self-preservation is big. So if you've got that going on and you're wanting to access executive brain, you know, I want to be operated on if I have to have an operation by a surgeon who is clean, who has their executive brain online. I don't want to be operated on by somebody who's sad. So what's our responsibility in that? And how do we help them shift, right? That is the job of coaching. So you're raising consciousness, you're raising awareness, and you're bringing people back to love word. And sometimes it's just, having them look at the choice they make around the fears, but they have to name them first. So name them, let them name them. Well, there's so much. I hope that I get more time with you. I know some of you I'm going to have time with beginning in August. I'm thrilled about that. And I just want to cover one more thing about the ICF. How many of you are ACC going for PCC? Do we have anybody who's already at the ACC level? Okay. Yeah. You're not going for PCC? You're already at PCC, Allison? Okay. So you don't have to do that. Are you going for MCC, Allison, or are you staying in your?
I did some mentor coaching, but I haven't pursued to do the MCC. It just seemed like extra work right now.
Yeah, I think that's where a lot of people are, is extra work. But I want to know if some of you are not already credentialed at the ACC level. Let me just show you what's happening. There are 3 changes I want to underscore, and then I'm going to let you all go. But there are new rules for ICF credentials beginning August 1st. We have been teaching and playing with the new competencies for 18 months. It's taken a long time for everything to come online, but because we're a global community and standards organization through the ICF, there have been some changes. We had a coach knowledge assessment that was not proctored. It was something you did online. It took about 3 hours. It's pretty rigorous. Now there's a new exam. It's proctored in person or virtually. If you're applying for your PCC, that you will need to take this exam, even if you've taken the CKA and passed. So I just want you to know that. If you're going for any new credential from ACC to PCC, that will be true, or PCC to MCC, that will be true. There will be a submission of a recording, even if you've had one that's passed with a school like ours or whatever program you've taken in the past year or so. It's going to be submitted with the application, and it has to meet the new markers whenever you are going for this next level credential. And the new competencies and markers are now online. If you haven't downloaded those and looked at them, they're training new groups of coach assessors. And what I want you to know is that you could have an assessor from Kenya, or you could have an assessor from Germany, or you could have an assessor who doesn't speak English as second language, and they're going to be assessing you against your competencies and listening to your recordings. And there's a lot of subjectivity. So I want you to know that, if you've got this in front of you, you may want to work with mentors and to really get your hands around how will these changes impact what you're up to. So that's what I know. That's probably a topic, Leanne, for a different conversation, but I just want to wrap up by saying it's a privilege to be with you. You're doing great work in the world. You have an amazing opportunity. And the reason that we put a stake in the ground for healthcare, because we worked, we were online to create a culture of coaching with Verizon when we merged 2 companies, Bell Atlantic and GTE. We've been doing this for a long time. And Sutter Health Systems on the West Coast, do we have anybody from Sutter here? No. After they read our white paper from this engagement survey that we did in 2014, 15, took us out, brought us out to the West Coast and wanted to create a culture of coaching and a coaching clinic as they were merging more hospital systems. And as we started down that path, Accenture and McKinsey were in, and they kind of blew up the whole notion of a HR division. And so we were in the second phase of doing the work to create the program, and we decided to do it anyway. So the bottom line is we have been, it's 2013, because we have been teaching coaching since 2013. And we put a stake in the ground for legacy work in this space, because this is 27% of the GDP. It's 1 in 4 people in the country works in life sciences, and your impact is huge. So let's keep going. Let's keep going together. Please let us know if you have ideas. Send us information if you think we need to know it, and we'll be sharing again soon, I hope. Leanne, back to you.
Thank you, DJ. Thanks, everybody. Appreciate your active participation and discussion. As a reminder, some of the materials, well, all of the materials DJ's shared will be in the member portal along with the recording for this call. And as Megan mentioned at the top, if you have suggestions for future council calls, feel free to please fill out the survey that came in the Lens Connection newsletter. And we always have the discussion board in between these calls for all of you to connect and ask questions of each other. But it's great to see everybody. Wishing you a safe and healthy rest of your summer, and we'll see you next call on September 8th. Take care.
Thanks, Paul.
Thank you.
Bye. Thank you, DJ.
Bye. Thank you, Liam. Bye, Megan.